In today's healthcare environment, we're seeing more and more patients with what feels like fewer resources. Add that in with the financial constraints we're under and the quality indicators that we're trying to meet, particularly around pressure ulcers. It really is quite a challenging environment to work in. What we're seeing day to day is an increase in the age of our general population. With that comes a lot of comorbidities. We're seeing an increase in diabetes and an increase in obesity. And obviously this brings with it increased risk factors, particularly around pressure ulceration.
The World Health Organization reports that as people age, they may become more susceptible to disease and disability. And the evidence suggests that 2 or more chronic conditions decreases our life expectancy.
So globally, we're seeing sicker, older and consequently higher risk patients. We know that prevention is better than cure when it comes to pressure ulcers. If we're lucky, we've got a full toolbox. Worst case scenario is we're sort of having to make do with what we've got around us. So that would be things like pillows. Whatever we're facing, we know there are cost-effective solutions out there to achieve better outcomes for our patients.
The latest guidelines suggest that we consider using a reactive air mattress or overlay for individuals at risk of developing pressure damage.
The concept of Repose is really simple.
Repose is a single-cell reactive air range of pressure ulcer prevention solutions manufactured from a durable polyurethane film that, when inflated with a pump and smart valve, delivers high levels of patient immersion and envelopment. It achieves this by combining consistently correct inflation with a film that can stretch up to 6 times. Immersion and envelopment is clinically proven to be a better way to prevent and treat pressure ulcers.
Repose improves patients' quality of care. We know that by clinical evidence that if you do develop pressure damage, it will take twice as long as it would on another system. What this means is it gives us longer to put in all the interventions that we need to reduce pressure damage.
Patients tell us that due to the low profile, they're able to get in and out of bed more easily and more safely, and that they find Repose comfortable and unobtrusive. This is really important because it promotes compliance.
A family member could easily inflate and deflate and clean the product, as well as qualified healthcare professionals. The pump is amazing because it's a storage device as well. It's also got all the instructions on it of how to inflate and deflate. We can pop it in the car, it's there, it's easy.
Repose can be used in any care setting, and the range supports vulnerable areas of the body.
Healthcare professionals and caregivers should use Repose because of its simple technology. It's clinically proven to work in pressure ulcer prevention and management. We can use it for all levels of risk and all categories of pressure ulceration. The research is there for us supporting its use, and we know that the patients accept it as well, so that's going to mean we get the outcomes we want.